Alright, so we are not actually history students, but for us to actually get to appreciate the concept of female sterilization better, it's nice for us to now look at a brief history of this whole practice. Okay, so a brief history of female sterilization. All right, so for the female sterilization, it's just a method of, you are trying to prevent pregnancy. Okay, you are preventing pregnancy by trying to create space in the fallopian tube so that the sperm doesn't get to meet the egg. So history of female sterilization is complex, right? So it spans around medical innovation, social changes, ethical controversies. So in the pre 1960s, it was typically reversed. Okay, that the type that were done were types that could be reversed later. So when pregnancy posed serious health risks, in the US, elective sterilization was rare and tightly regulated. Often requires formulas like the age multiplied by the number of children, okay, equals to or minus 120 before they will approve you. Okay, so in 1960s to 1970s, advances in surgical techniques and changing cultural attitudes towards family planning led to wider acceptance of sterilization. Okay, so before it wasn't really a thing that was accepted like that. So we have a eugenics movement, which was basically in the early 20th century. Sterilization was weaponized by eugenics, especially in US. Okay, so the first people that they didn't want them to reproduce, for these people to undertake sterilization. Okay, so they usually targeted black people as at that time. Okay, so it wasn't really a nice thing as at that time. Now, coercive practices in 1960s, Mexican American women were sterilized without proper consent at the Los Angeles County Medical Center. 1970s, Native American women underwent involuntary sterilization, okay, through federal funded programs. The 21st century, cases emerged of female inmates of California and immigrant women in Georgia being sterilized without their consent. Okay, so it was now used for bad practice. Okay, earlier on, so modern techniques and methods in nowadays, what they usually use is tubal ligation like this. They cut the tubes, so of course nothing is passing from up down, nothing is passing from down up. Then in salpingectomy, okay, which is basically removal of the fallopian tube totally. So global use, about 190 million couples worldwide actually rely on this sterilization so that they can actually control, the child birth rates. Okay, so that's what we have for this a brief history of female sterilization.